Good afternoon, everyone. Happy holidays, happy upcoming new year. I want to wish all of you peace, health, and productive, informative, interesting training today so that each of us could take from the course something that he or she needs to maximum. If there are some questions or you need to clarify something or you need to find out more, we will stay in touch with you. There will be a group created in WhatsApp where you can ask questions in terms of practical aspects of palette usage, dosage, consultations in terms of clinical recommendations on each patient individually. I'd like to say that we are here available 24/7 for you, but maybe there may be some delay due to power disconnection or internet disconnection in Ukraine, but we try to do our best and rapidly answer the questions of our listeners and students, and sooner or later each of you will be able to develop the technique and methodology and the principle of the selection of the dosage of pellets for every patient individually. So today we're speaking about the biotechnology of the future, Biopell Medical technology. The lecture will be divided into some blocks, which we will lead together with Lina Hirsch, gynecologist, endocrinologist, the doctor of the highest category. You'll get to see her later when she speaks about the pellets and dosages which are aimed for the female group, for the women. I'm the urologist and urologist, and I will tell you partly about the general endocrinology and the pellets used both for men and women. And of course, I will emphasize the prescription of pellets for males, for men, what pellets are unique. And anyway, we will discuss with you the specifics of the usage of these medications, because this is bioidentical medication and in different groups of patients in different clinical cases. For your convenience, you can see the presentation in PDF format, and it has a few blocks with short notes and annotations for your convenience to find quickly the necessary information so that you would remember and make some notes and maybe take a part of the presentation for some marketing purposes for the patients to put this information on the social networks or other mass media channels that you use to communicate about the necessity of it for your patients. So the first block is the general knowledge, general information, where we will get to know about bioidentics as it is, and we will understand what, first of all, bioidentic makes it better than the synthetic medications, the uniqueness of the form of the pellets, why it's convenient, why it's used among the patients more and more frequently, and why the number of patients using it daily goes up, not only in Ukraine, but also abroad. So that's the way bioidentical implants look like. They are packaged fully into this, they are fully sterile, and they are in the non-pervasive vacuum ampoules, convenient for transportation. They don't seem very huge in size, and they can be easily put into the subcutaneous fat tissue. And we will discuss this point later during the lecture to remove the fears whether these implants may be visible under the skin of both men and women. The main component of the pellets is that in most cases is hormonal. That's why we have to remind you that hormones are the most important elements in the life of every person, in health, in appearance, in activity, and the pace of aging, and the risks of different disease occurrence, which may happen for every patient. That's why hormones is something that wakes us up that sets us in motion from the Greek language, and it's difficult to find some function in the body or some manifestation of biological activity of the patient without the usage or without the usage of hormones. So then again, let me repeat, the way we look, the way we live, the way we move, the way we express our emotions, how we are physically active or passive, it really strongly depends on the hormones inside our bodies. So that's why it's difficult to overestimate their contribution into our health and into our daily activities. Why do we emphasize that? Because the area of application and the data which helps us identify the possibility of hormonal disbalance is quite broad. That's why the release of hormones and it all depends on our mood and quality of sleep and the work of our immune system and the reaction fight or flight, which has a strong impact on our physical and intellectual activity of our daily lives, on the quality of our sexual activity, orgasmic emotions, emotion brightness in particular. That's everything that hormones control and that's everything that influences hormonal activity. That's why taking the patient history and understanding whether the patients have hormonal disbalances, we have to take into account not only the blood test results, but also we have to clarify the smallest details, social, intellectual, and physical and psycho-emotional activity of the patient. That's why it's not just the external factors like the skin quality, quality of your hair or nails. It's also about what patients don't notice right away, our psychotype, emotional stability to external factors, and of course the comprehensive manifestation of us in the society, at work, and in the family. We'll get back to it later, and when we discuss every medication separately, we'll be able to discuss where we can emphasize and focus on the disbalance in terms of some hormonal components in our health. Let's remember that hormonal system is all comprehensive component of our health, yet it's one of the most difficult mechanisms, regulatory mechanisms in our body. We remember about the regulation levels from top down. We have the pituitary gland, epiphyse, the adrenal glands, hepatocytes of the liver, and more actively, increasingly popular role of the gastrointestinal tract, our intestines and microbiota and hormonal processes in our body are regulated by it. So for now, I think that the volume and the variation of different bio ingredients in the pellets includes the regulation of work of both thyroid gland, then pancreatic gland, and of course, it's really important to take into account the regulatory factors in terms of the normalization of the work of the gonade, ovaries for women, testicles for men, and also that's about the improvement or normalization of fertility for both men and women with the help of hormonal medicine, which is available in Biopell and which we will discuss and select the dosage individually for patients. So if we speak about hormonal disbalances in men and look at if we speak about hormonal disbalances among men and evaluate not only their physical condition, but also clinically important processes, pathological processes, we can speak about the fact that for the doctor who plans to provide hormonal correction or hormonal assistant therapy, it's important to assess the weight, whether the person is overweight or not, libido level. The man should not have the total absence of libido, the orgasmic emotions, may go down, and the frequency of libido as it is may also be different. It's also the decrease of some elements of being motivated, i.e. depression, apathy that the man has, and all these manifestations, they come slowly. They don't happen in one day. They happen very slowly and really significantly change the paradigm for the patient in an, and the condition of the patient. So if we ask the man, if we ask the patient whether he has some complaints on emotional condition or sexual activity, and at the same time his hormonal changes happens not very quickly, he will say that everything is fine. But when you ask about the frequency of sexual contact and the quality of the sleep, what time the person goes to bed, what time the person wakes up, and how many times he wakes up during the night, and when you ask how bright are emotions due to some present purchases, accomplishments, and other positive things, then these questions give you a chance to understand, and for the man to understand that the normality of his life transformed. What he perceived normal is not normal, and he simply forgets what it has to be like. And the frequent picture that we see among the patients after, as a result of hormonal correction, when the patient himself says that he really understood right now that a few months ago, before the prescription of the adequate treatment, his condition wasn't okay. And right now he understands the difference, what he can be like, how stress resistant he can be, how he can behave. And let me repeat, how many emotions he can show due to good or bad reasons, and how tolerant he may be to physical, intellectual, emotional pressure. And very often the patient evaluates own pathological condition as normal condition. That's why the task of the doctor, when he gathers and collects the patient's history anamnesis, to scrutinize the critical condition of the patient, not from the side of whether he's okay or not okay with his condition, but from the perspective of what's normal, what's according to the questionnaires about the regularity of his coitus and the regularity of his physical exercises and desire to do physical exercises, because the decrease of the desire to do some physical exercises may be the result of androgenic deficiency. And in any situation, the man cannot be forced to do some physical activities, maybe the small sign of androgenic deficiency. Classical and non-classical symptoms. If we speak about the classical symptoms of hormonal deficiency among women, we can speak about depression, mood swings, extra weight, times, which is often occurrent for women, decreased libido or absence of libido, which is less noticeable for women, chronic fatigue and chronic apathy. Less subjectively, we can evaluate, but at the same time, we have the scale of hyperdensimetrics, which show the percentage and correlation of the bone mass, muscle mass, fat, fluid in the body, which can tell us about the decrease of the tone of the muscles, even if the appearance is great and physical appearance is quite good. The decrease of general physical form and the tolerance to physical exercises goes down, and physical exercises make her more tired. The so-called premenstrual syndrome, which has a lot of different manifestations, starting from pain syndrome and down to psycho-emotional abrupt changes, skin sagging, which is noticeable by cosmetologists first of all, and who can indicate to that symptom. And if the task is to solve not only the external problem, but to find the reason, one of the reasons may be the hormonal disbalances and disorders. The dryness of the mucus, vulva, and vagina, which is usual for more elderly women and which may cause the inflammation of the urinary tract and the increase of the risk of neoplastic processes on the background of hormonal deficiency, alopecia, and hair loss.
Non-classic effects, which actually not only physicians but patients never notice, is hyperpigmentation of skin, keratosis, acne on skin, muscle pain, also itching, and also many physicians indicate that even non-traditional physicians and psychiatrists and manual therapists say that one of the causes may again be hormonal disbalance, which requires correction, which may be just a mono symptom without any additional complications. Also, paresthesia and parodontosis. Strangely enough, the same dentistry problems may arise, and the first initial cause may be with hormonal changes, hormonal disorders. As we already discussed, the correction methods of hormonal disorders in men directly are directed to hormonal disorders in men. Everything that surrounds us and the way we feel ourselves and manifest ourselves in the world around depends on hormones, and how we behave, how we feel in the outer world also influences our hormonal factor, hormonal status. Well, everything is interconnected, so very often we repeat to our listeners that pellets is a part of hormonal correction, which should be in a complex therapy. If you want to achieve therapeutic effect, but not just symptomatic effect from implanting this medication, you should convey this to the patient and explain what additional changes should take place in his or her life. If we speak about banal sports, the patient should understand that sports, physical activities, will enhance the bioidentic hormonal therapy, and the effects will be more distinct and more stable. Once the pellets stop acting, the positive effect of this therapy will be longer. And it's very important to convey to a patient that if before that the physical activity in gym was quite exhausting for the patient and didn't provide any visual effect, but simultaneously with the medicamental hormonal correction, the probability of seeing faster changes and effects, and to use physical activities will be endured by the patient more easily, and the recovery period will be faster and the result will be more vivid. So a complex solution enhances and intensifies the effect of pellet therapy and makes the result more therapeutically stable, which again is many men are afraid when they come to undergo this therapy. They are afraid of a temporary effect without an opportunity to preserve this effect once the medication stops acting. There is no problem in complex therapy to use herbal busters, which we all know, the proc-hormones, which can enhance the functionality of pellets and continue their efficacy. If we speak of the classical forms, which are already known, and we will compare them with bioidentic therapy with pellets, this is in the injections, modified release forms, sometimes which will not disintegrate, subcutaneous, pills, plasters, physiotherapy, and finally pellets. Everything may be used all together, at which stages, and how to combine these medications. This is what we will discuss today in more detail when we discuss every pellet separately. The same applies to women, the same sports, herbal medications, injections, modified release forms, which we all know, and which are quite substantially described and analyzed in terms of the efficacy of every dose and contraindications. Also, plasters, pills, physiotherapy, and pellets again. So basically, the applications are the same, but the dosage are different, and the active substances are different. What is the benefit? What is the uniqueness of pellets compared to other habitual forms which are considered to be classic in the market? If we take the leaders, this is Nixon, creams, shots, and pellets. According to compliance and the convenience of application of medications, pellets are number one, of course, because the injection forms, let's say forms which entail several threats, since it is necessary to disturb the skin integrity, and the injection of a medication goes into the muscle, we have a risk of post-injection complications. And not every patient can do injection herself or himself, so he or she should visit a doctor, and these visits should be regularly, which are time-consuming and not always available for patients. And in this case, the number of injections within a year is quite substantial, up to from 50 to 150 injections a year, because hormonal therapy actually is intended for long-term to ensure therapeutic effects. Creams are very complex form for precise control of the dosage and for achievement of regulated constant therapeutic plateau of concentration of medication in blood. The convenience of using the creams is also complicated by the fact that it should be applied daily or even twice a day on the skin surface in order to support more or less stable effect or concentration in blood of this medication. But it's very important not to talk about forms, because pellets are totally disintegrate subcutaneously, but also the uniqueness of their bioidentity. Biopharmaceuticals, what is this? Biopharmaceuticals today is a production of medicinal products from any biological sources. These medications may originate from various sources like human, animal origin, herbal origin, fungi, and even microbes. So anything that contains biological material may be a source for biopharmaceuticals. And simultaneously, there is a search for a maximum similar or almost identical DNA form, which eventually has to become an active substance and perform the function of a certain medication. In this case, when we speak about Biopell products, we speak about hormonal medications first and foremost. So these medications should have the function of steroid activity. So we choose the biological material, the molecule build, molecule composition, which is very similar to this hormone molecule structure. And in order to perform this hormone structure, a DNA recombination technology is applied to improve this DNA form to ensure the 99% similarity. This simplifies and the functionality of this medication in the body, because such medications are perceived more naturally compared to synthetic products. There is less competition with receptors, which decreases sensitivity of our biological receptors to hormonal medications, and they don't have toxic metabolites like synthetic medications. And very important point is that these medications do not inhibit or do not remove their own the body's own production of hormones in case of a hormone replacement therapy is used in such form. Now on this slide you see the article which is actually describing comparison of two testosterones, biological and synthetic, and these two testosterones have the minimal difference, but this minimal difference actually makes it possible to get less side effects, adverse effects, and get more compliance to ensure more physiological effect and action of this medication. And as a consequence, it is more safely tolerated by patients, and patients feel better. So the physiological action of this medication is very close to our own natural hormones. So all the functions which we expect from the medications in terms of improvement of our appearance or our health, these sensations will be, in effects, will be more natural for a patient and more controlled. So the biggest value of bioidentical medications is maximal similarity to the biological hormones in this case, and the physiological action of these medications on our body with the minimal number of adverse effects. We will repeat that in this case, thanks to DNA recombination technology, unlike the regular phytotherapy and active substances, when there is a minimal dose of hormones in pellets, we have the maximal effect and the most prolonged effect. It is possible to use pellets with various dosages for women and men. We'll discuss this today. And unlike competitors, where the forms are not don't disintegrate, these pellets, Biopell pellets, disintegrate fully in the organism. They have minimal size, and there is a very big variety of physiological doses which a profit compared to other types of forms like injections of creams or modified release forms which are used for applying and administering testosterone. So pellet medications have many doses. We can apply specific doses and combinations of them for specific patients and apply this medication with less risks and the minimal number of adverse effects. What you now see on the slide is actually what we've just discussed, but I should say again that in synthetic medications compared to bioidentical medications, there are certain cancerogenic metabolites which are harmful for the organism and bear risks for producing cancer type processes in the body of a patient. Which is very important for bioidentical medications is that the clinical effect comes quite slowly, but it is totally controlled, almost totally controlled. We can explain to a patient after which time we will get a therapeutic result, but there will be no leaps or sharp changes in the patient's condition, and this decreases the risk of any pathological effects, especially in the place where the medicine is applied. What is very important for a patient and for doctors, it's implanted form, and this provides to release the active substance of the medications without bypassing the gastrointestinal tract. Any nutrition preferences or any absence of performing recommendations as to taking this medication, no need to comply with number of meals, it's irrelevant, and this does not influence the efficacy of the working with the active substance itself. Since we don't have any tight, any connection to disintegration or administration of the medicine through the gastrointestinal tract, this medication is stably and gradually administered in the body 24 hours a day. And this is very important. And also, when we decrease the dosage to minimal numbers, the hormonal active substances at the minimal doses, we get the minimal number of adverse effects, because large doses is what we don't need, because again, the gastrointestinal tract will not affect the decrease of the concentration of the substance in blood. So whatever we prescribe for a patient and use as an implanted form, everything will be in blood and will be processed 100%.
And total allergy-free, absence of allergic reaction to these medications. So as the producer states, the components of the pellet, soya and yams, which are the content of it, do not cause any allergic reaction. And over the years of the usage of these medications, we haven't seen any allergies among our patients. This is the comparison table in terms of different forms of management, that different forms of injection that we can show you to understand the comfort and convenience of the ingredient release. The first one is the pellet therapy. The only mistake is that there is no abrupt increase of the concentration in the blood of this medication, and the accumulation is quite slow. If we speak about hormonal accumulation, it's about 3-4 weeks, about 3 weeks. If we speak about the medications like Abilify, metformin, then they can be accumulated closer to the end of the first week, the beginning of the second week, from the beginning of the injection. But it's slower than patches or perioral oral medications or creams. And in contrast to all the injection forms that are shown on this table, for sure we can state that there is no so-called fluctuation of the concentration of the medication, which on the one hand may cause different damage to the health of the patient and cause the change of the patient's condition and decrease of the level of satisfaction due to therapeutic effect and smaller likelihood of therapeutic effect achievement. So the long-term plateau of bioidentical pellets of Biopell company is one of the most important and highlighting aspects which speak about the benefits of the application of this methodology. So let's go back to the benefits. Full possibility of the pellets to get absorbed in the subcutaneous fat tissue. You don't need to get it, it does not get it out. And one implantation means that you don't need to remove this implant. The activity of pellets from 4 to 6 months, depending on the active ingredient and the dosage. The size is 3 to 5 millimeters, 1 or 2 rice grains. And right now the producer is Brazil, and they are used all over the world in Western Europe and in the countries of the Northern America in particular, and Asian countries. international experience of pellet usage is quite widespread. It's not the medication that just entered the market yesterday or today. This is the really tested medication and well recommended medication. We can share the links to the articles you can read, and as a result, all of them say that this is the comparison of medications by identical ones and synthetic ones, which show better compliance of bioidentical implants, better tolerability, and, as we said, more physiological effect from the prescription of hormonal therapy for the patients in contrast to the prescription of synthetic medication. Nobody Absolutely, it's not a secret that hormonal therapy for now is used in particular also to treat and prevent a lot of oncological diseases. To use pellet therapy to treat oncology is not recommended at all since this medication is not a part of the most protocols of the state. And we recommend to use this group of medications for the prevention of possible diseases and hormone correcting or hormone replacement therapy for patients without oncological risks. But the experience of the usage of such medications is there in the world. And since this is the overview of our article and they are not double controlled researches, but they simply show the clinical significance of of a lot of groups which were researched. So we can take into account these results, but we cannot rely on them as we can rely on the protocols. The list of active ingredients, which is introduced by Biopell in pellets, is quite big. It's hormonal and non-hormonal estradiol, gastrinone, and in different forms. And we will tell you the endocrinologist and gynecologist, gonadotropin, hydrocortisone, metformin, non-hormonal format, and nicotinamide hydrate, dehydrotestosterone sulfate, progesterone, and my favorite as a neurologist, tadalafil, and really important hormone testosterone. And also, Biopell company has new medications for thyroid gland, I mean T3, T4, which have a lot, which are on the market and can be used in Ukraine and in the Eastern Europe for thyroid gland diseases. And these medications can be actively used to decrease the body mass and to treat or comprehensively treat psycho-emotional diseases, because thyroid gland in this case is one of the most important organs in the body. Let's take a short coffee break and then we will move on to the andrology block where we will tell you more about hormonal therapy among men. Let's start with the second block, andrology, and the first hormone, the most important one and the most widely used, that has fantastic number of application both in the female and male bodies, testosterone. Female testosterone is produced by ovaries and the adrenal cortex, and about the application, dosages, and the situations related to the necessity to use this hormone, Lina Irha will speak more about it, our gynecologist and endocrinologist, and today I will try to explain you the application of testosterone among men, which is produced in men by the adrenal cortex and Leydig cells. When we speak about when we need to use this hormone, we have to remember that androgenic deficiency among men is very relevant problem in the world, and it needs to be really corrected, and the approach has to be serious. In the USA, the low level of testosterone, the fact that it goes down below the lower level of the norm, is the situation for 4 to 5 million men. And according to the assessment of scientists, about 43% of men, almost half of men aged from 65 years, they suffer from age androgenic deficiency. And after 30 years, after the age of 30, testosterone decreases approximately by 1% every year for every man. And at the same time, according to the WHO data, in 1987, approximately 17% of men had testosterone on higher level than we have it today. And it's important to say that over the last 30 years, the quality of the spermogram, the norm for the sperm according to the recommendations of the World Health Organization, were reduced by 2 times, not simply because, as I say, female ovaries, they produce better quality than men, but also because as healthy men that were 30 years ago don't exist. And from 1993, over the last 20 years, the sales have increased 5 times. So the usage of testosterone increased by 5 times. And at the same time, it's not only the necessity of the doctors, but understanding of the patients who understand that without this medication, the quality of their lives suffers. If we speak about the usage of testosterone containing medications in Northern America among the non-professional sportsmen, simply those people who go to gym, the number fluctuates from 15 to 25%. I mean, people who go to gym. And also we have to keep in mind that testosterone is not only about sex, it's not only about the muscles and physical form, but it's also about fertility, because the quality of testosterone by the testicle, produced by the testicles, is related to the possibility to produce sperm. So significant androgenic deficiency is directly connected to the fertility disorders and disorders in terms of sperm formation. And only 5% of men who have hypogonadism, androgenic deficiency, receive adequate treatment. Only 5% of men get the necessary treatment with this problem. And if we go deeper into the statistics, these 5% of men is a very optimistic number, because no more than 1/3 of all the men who in general have different hypogonadism, they go to doctors. So in most cases, they suffer quietly and they don't receive neither the treatment nor diagnosis. And it's really important to keep in mind the fact that testosterone is important, and it has an impact not only on the our muscles and cardiac muscles and normal testosterone quantity, it has the cardioprotective effect. So patients of older age for whom sexual activity is not really relevant, it's always relevant and it's always important to have normal condition of their cardiovascular system and heart muscles, cardio muscles. And even if the patient is in the with the normal body mass index, and if the patient has moderate sexual activity, and it's enough for the patient to have that phase, but at the same time, we clearly see androgenic deficiency in terms of testosterone. We have to remind both to ourselves and to the patient that testosterone or testosterone deficiency reduces the quality of work of the cardiac muscles. Lack of testosterone increases the likelihood of stroke and of heart attack, and spontaneous death due to the heart failure. And when we have the decrease of testosterone, the likelihood increases for Alzheimer's disease and Parkinson and dementia. In this slide, you can see the information about the influence of testosterone concentration and the development of complications due to COVID pandemics, due to coronavirus, which is statistically reliably showing that the patients with low testosterone level have the risk of severe COVID disease. The higher testosterone is, the lighter the form of COVID will be and the faster the patient will recover after the COVID. It's also important to keep in mind that with COVID, this is the supported data all over the world among men that because of COVID, testosterone goes down. Why it happens? Well, there are a lot of theories, but as a fact, it is there, and the timely hormonal therapy with testosterone is highly important, not only to prevent or reduce the risks of COVID disease, but also to recover faster from COVID. Also, there is a tight connection of the testosterone and stress resilience. And when we speak about the statistically important or leading role of stress in terms of
When we speak about the role of testosterone, we speak about stress. In particular, stress is the factor which first of all leads to testosterone decrease in our body. So when testosterone content decreases, we have less stress resistance, and we are more stressed. This is like a vicious circle, which more and more leads to aggravation of a person's health, in this case a man's health, and we have to drag him out of that pit through medications and hormonal correction. By increasing the testosterone dosage, we enhance stress resistance. Patient is less stressed, and we can talk about recovery of the testosterone levels more or less. At the same time, objectively, if we tie this to stress resistance, according to the research which is now presented on this slide, there is a correlation. The correlation has been studied of the how the stress resistance combines with the hormone content in blood, which shows that actually the higher testosterone levels, the higher is the stress resistance, and the less stressed a person will be on a daily basis. Foreign experience of applying testosterone pellets indicates quite broad application of such medications. One of the bright and vivid examples is using implants with testosterone on rats, tested rats, on the International Cosmic Station of NASA. And we all understand perfectly well that in no weight conditions, the no gravity conditions, the muscle tone decreases quite fast, but when there are higher doses or higher levels of implants with higher doses of testosterone are applied, the muscle tone is preserved, and the rats who didn't get such a hormone replacement therapy, they had problems with. So, what is the conclusion? That even without physical exercises, even in no gravity conditions, testosterone positively influences our muscle tone and physical shape. Subject to this such a condition that there should be at least moderate physical activity, some gym exercises, and then we have a multiple effect of hormone replacement therapy. Also, there are studies which have been conducted in North America, and they showed the comparison of 3 tested groups. One group is patients who were practiced without using any steroid hormone medications. The second group of patients were practicing physically and used hormones, but the third group didn't practice but used hormone replacement therapy. Of course, the best result was with the group which combined physical activity with hormonal therapy, but strangely enough, similar results were observed in the group which had only sports and the one which only had hormones. They had quite similar effect. So what is the conclusion? That hormones play a very big role combined with physical exercises. So you shouldn't advise your patients to just take hormones and lie on a couch, but you should emphasize that the better effect if they will will use bioidentic pellets together with physical exercise. Here we see the example of a patient who had implants of pellets with testosterone, and after that the patient went for quite a long-lasting rest, vacation with alcohol, all-inclusive meals, but the muscle tone and his relief, the prominence of his muscles even improved, even when he had such a wrong approach to hormonal replacement therapy, but there was still an effect. The next medication is phosphodiesterase type 5. It's tadalafil, which you had in pellet list. This is not a hormonal medication. It is responsible for microcirculation, the quality of how the body organs are supplied with blood, and the penis in particular. This is a far relative of Viagra. Viagra has sildenafil in it, but now we talk about protodolafil, which is a new generation of this group of medications, and it has a therapeutical effect unlike Viagra. Therapeutical effect is that together with applying this medication, we have restoration or improvement of microcirculation in penis and other neighboring organs, and also endothelium is improved in vessels, and new vessels are stimulated, the so-called angiogenesis. Tadalafil is aimed at improving blood flow. When we talk about pellets with testosterone, it can improve the situation with libido and a willingness to have sex and the vivid brightness of sexual sensations. The tadalafil helps to improve the corrective function. This is what we observe in patients, and these factors we will also describe below. Most importantly, you should remember that tadalafil does not enhance sexual desire. Tadalafil will not solve the libido decrease issue. There has to be combined therapy with tadalafil and testosterone. because testosterone will provide libido enhancement, and tadalafil will provide toughness of erection. If we speak about the Viagra medication, which is short-term effect with about 4 hours of effect, and in this case, the patient will be feeling himself well and confident 24 hours a day. In practice, when there is no medication such as Viagra at hand, for example, a patient will forget about it. For some reasons, these patients who have severe dysfunction, they have problems with erection, and this, of course, negatively affects their psychological state, and they are unwilling to have sexual contacts. And the erectile function may be also due to vessel disorder, and also in addition to this, there is a dysfunction of psychogenic character when the organism, the body itself is working okay, but the psycho-emotional attachment to the expectations of a certain result do not enable a person to reach this result. And there is a very important remark that one pellet with tadalafil replaces hundreds of pills. So it's not just a good compliance, but it's a profitable purchase and financially beneficial medical therapy, because when a person just has a pellet with tadalafil, it's much more profitable than using pills on a daily basis or regular basis. It's very important to indicate that tadalafil has a cardioprotective effect, which is confirmed by studies. This is very important, especially for patients of an elderly age with minimal doses, and it's very important also for treating and removing the COVID consequences as well, because this group of medications improves the intrapulmonary dynamics and enhances the speed and the quality of the vessel repair. So tadalafil is not just the medication which improves erection, but it also has a cardioprotective effect, and it also ensures protection against COVID. And also there are studies on the third stage already which show that tadalafil is very important for treating metabolic syndrome, to decrease body weight, and to fight obesity. What's important to notice that tadalafil, when it is taken on a daily basis, 5 grams, it is in protocols of the European and American Associations of Urology, not just for improving erection, but to decrease the risk or the danger of complications in chronic prostatitis, and also to decrease the speed of age changes in prostate. Since the medication improves blood flow in the body, and these are the additional positive effects which we get in a man in addition to the quality of erection. So you need to convey this information to physicians and to patients that this medication is a highly therapeutic and not just symptomatic. The dosage of tadalafil is quite simply to choose. You take 10 or 20 milligrams of tableted forms, which is equivalent to 200 milligrams of pellet for half a year. So 5 milligrams in a pill, it's 50 milligrams in a pellet, and so basically we divide by 10 and get an equivalent of a pill form, because in pill, the tablet form, before implanting the pellet, you can choose the dosage specific for the patient. You can determine the dosage which you need in pills for comfortable sensations of a patient. Then you should multiply it by 10, the daily dosage, I mean, and then you will understand which amount of tadalafil you need to implant for half a year. The overall effect, the average effect of tadalafil when it is implanted is already noticed in 10 days, in 7 to 10 days after administration. Many patients are afraid of sexual failure, so they already notice right away during the first week, they notice the improved erection in the morning. Anastrozole is the next medication, which is quite an efficient inhibitor of aromatase, which decreases testosterone and estradiol. And we have such risks when a patient has sharp increase of testosterone in concentrations in blood. But as we discussed in pellets, we don't have with pellets we don't have such a situation, and we don't expect such a situation. So the risks are if a patient is in quite a serious phase of obesity, if he has an excess weight, significantly excess weight, then the hormone, the fat tissue can cause aromatization of in line with high levels of testosterone. So, for example, there are some patients where we implant pellets, but they have no opportunity to undergo control of their condition. If, for example, your patient is quite in contact and he makes it possible to check his blood on a monthly basis, which is actually what we urge our patient to do, that, for example, when there is the first implantation, a man is supposed to undergo blood tests for hormones at least during the first months in order for us to control this the status. So if a patient is accessible for such control, then we are actually against administering anastrozole, because they have this surge of aromatization, and this may be stopped by a tableted form, anastrozole. Why should we be afraid of anastrozole in a pellet? Because if we decrease the estradiol concentration in a man for a long time, then we first lose libido. So any sexual moods and pleasure will actually be in line with anastrozole administration. All sportsmen, all athletes know this when they take tableted anastrozole, and libido suffers in the first place.
That's why this pellet may be applied, but the patient has to be prepared and informed about the changes which may happen in his condition due to the intake of this medication, and if possible, to take the pill form. We have 5-minute break before the next block, and we will let's continue and start the third block, where we start from such medication which has recently appeared as a pellet in pellet form in Biopell. It is named stanzadol, and it is known. This stanzadol is known for bodybuilders and those who go to gyms, and it is used not only for people who go to gym, but also for those who want to improve their physical form. This is the anabolic steroid drug, dihydrotestosterone derivative, and it is different from testosterone by the replacement of one carbonyl group, 2-methyl. Danazol is the active antagonist of progesterone. So what is its pharmacological activity? It stimulates anabolic processes and inhibits catabolic processes which are caused by glucocorticosteroids. It improves trophics of the tissue, and it promotes calcium deposit in the bones, and also nitrogen, sulfur, and phosphorus deposits in the body. In terms of tadalafil and testosterone, one more point about the contraindications of them, because right now we will face the medications related tightly to testosterone. So it's important to say in what areas and in what situations this medication shouldn't be prescribed. Let's start from tadalafil. In most cases, it's significant disorders of cardiovascular system and cardiac insufficiency and rhythm disorder, but also the final decision will be after the cardiologist, after the necessary tests, and that's it. So when we speak about testosterone, the contraindication is cancer of prostatic gland and the tumor of the testicles. Why? Because prostate cancer is hormone dependent, and testosterone stimulation will cause progression of the disease. At the same time, it's important to remember that testosterone is not a physiological factor of the development of the prostate cancer. At first, its decrease causes the changes in the prostate gland, and it causes cancer cells appearing. And timely hormonal correction with testosterone will reduce the risks of development or the terms of the development of the prostate cancer. Contraindication to prescribe testosterone is also severe cardiac insufficiency. As a result, we expect the fluid accumulation when we prescribe testosterone and the increase of the blood pressure. The so-called contraindication to testosterone is also the urinal disease and also kidney and also kidney stones, because it is provoked by the calcium in the bones and the calcium stones in the urinary system. Since the kidney stone disease takes the leading position in terms of urological diseases in general, a lot of patients have this disease, have this problem, but if this problem doesn't affect just one functioning kidney or aggressive disease form, then testosterone prescription for such patients requires more control, but it's not a severe contraindication. Let's go back to danazol. Of course, it's similar to testosterone. Contraindications like oncology and the cancer of testicles, cardiovascular disease, and kidney stones. And also prostate gland cancer. And This story has started from Seoul Olympics when Ben Jones, who was the winner, was disqualified because he took this medication. Later, this medication was used by amateur sportsmen and it was known by informants as Tromba, and it was really favored anabolic medication to achieve more bright sports result. The list of the athletes and runners who were caught taking this medication, you can see their photos here in this slide. All of the medications which enter sports area don't have classical contraindications for different pathological diseases, but stanozolol was used to treat patients with severe cachexia, a disorder of synthesis of proteins, to stimulate anabolic processes for post-surgery recovery, treatment of the muscle dystrophics. So in the situations when it was important to increase the mass and stimulate the active reparation and recovery of different uh, tissues. How can it help a person in sports? It quickly helps to receive the prominence of the muscles, and it is used during so-called shredding, muscle shredding among sportsmen to create this prominence of the muscles. It really helps well in burning fat, but one of the side effects is the increased appetite among patients and some among sportsmen, but patients who use stanozolol not in the form of pellets but in the form of classical form, they say that the appetite increases and it's impossible to satisfy this appetite, and all the time the person has to eat fats and carbs to saturate the body with calories. Due to the competitive inhibition of the progesterone receptors, this medication has anti-estrogenic and progesterone effect, anti-progesterone effect. It's important to for the in terms of the side effects for women who take this medication, and what complications can we observe? The blood pressure increase, which is usual for testosterone as well. The increase of cholesterol due to the follicle sensitive receptors affect people may have hair loss, acne, the inhibition of the production of personal testosterone, which is usual for the high dosage of stanozol and toxic for the liver, and hypertrophics of myocardium, which is also related to the high dosages of these medications. Contraindications are really similar to the contraindications for testosterone. As we said, of course, this is individual sensitivity to the medication as it is. The cancer of the prostate gland for women, this is the cancer of the mammal gland, carcinoma of mammal gland with hypercalcemia, and severe cardiac insufficiency, liver insufficiency, or hepatic insufficiency. During acute prostatitis, the patient probably will not put any pellet because there will be high temperature and disoric disorders, and also standard contraindications, child age, teenage age, pregnancy, and breastfeeding period. The next medication that also appeared recently and is quite specific on the market and in terms of the intake is naltrexone. About half a year or a year, it is like the active Biopell ingredient, and the main function is the competitive opioid receptor antagonist. It is widely used for a long time for treatment of patients with addictive disorders. At the same time, it doesn't cause addiction, but it has a lot of different contraindications. This medication has been long used for treatment of addiction disorders and alcoholism for binding opioid receptors and to reduce the need to use alcohol or other substances. The side effects of classical naltrexone are very rare. As a rule, it is related to the sleep disorders, psycho-emotional disorders, and possible reduction of peristaltics, which causes constipation, bloating, and heavy feelings in the stomach. And it also influences the activity and the work of our muscle fibers and the complication of getting aroused. This is the non-active and ejaculation and reduction of potential. It's important to keep in mind that this group of medications is contraindicated for patients who are still continuing to take the strong medications, I mean substances and alcohol. And it is really important for the patient in case the patient plans different surgeries, because this really limits and partly complicates the possibility to provide a resuscitation for the patient and anesthetics for the patient. So the group of medications which may have an impact on the opioid receptors in this case is contraindication. At the same time, according to the rules of naltrexone implantation, it's important to control function of the liver and kidneys. And it's important to say that it's likely that the focus, attention will decrease while driving. So it will limit the usage of this medication for some people. Also, the other side effects, why it's used by Biopell company and why it's prescribed. So this medication may be used and can be used to treat the patients with obesity, to treat patients with extra weight. It has an influence on the central nervous system and inhibits hunger feeling and helps to reduce the volume of the food intake and reduce the intake of calories which the person receives with the food, and this way, without surgeries, it enables to fight the problem of obesity and extra weight. Low dosage of naltrexone are approved to be used among the patients, approved by FDA to regulate appetite, to regulate and mildly stimulate the growth factor hormone and build up muscle mass and speed up the processes of fat burning, and at the same time to improve the emotional mental condition of the patient, to boost mood and reduce the stress, and it increases stress resilience. But here we speak about minimal dosage because we just said that naltrexone, the overdosage of naltrexone provides the same effects, but in the side effect group. Sleep disorders, high arousal, depression, apathy, and reduction of stress resilience. So the dosage has to be minimal. And at the same time, we keep in mind that in pellets, we use it for half a year. So the term of freeing or release of this medication is really long. What's important to say to the patient that this medication, which is according to the recommendations of the European Agency of Medicine, is indicated for the patient to fight with extra weight only if it is together with low-calorie diet and physical activity. The European Association recommends to use this medication only as a complex treatment, low-calorie diet and physical activity together with it. And it's important to say about it that naltrexone as monotherapy will not work. And as a rule, it is important, it will probably be important to combine it with the hormonal medications and medications which fight with insulin resistance. And in this case, we speak about metformin and metformin with sitagliptin.
The next pellets, which we would like to discuss with you, are pellets with melatonin and why do we need them and how we can use them. Melatonin and pregnenolone. Pregnenolone will be the first one to describe. It is one of the main hormones in steroidogenesis. It is so-called the father of all steroids. It's the main hormone for memory, responsible for memory and thinking. So it may be called the main neurosteroid, which is first of all needed for stimulating our central nervous system. And pregnenolone, it's the endocannabinoid, which is actually the one that improves our mood, decreases anxiety, improves sleep, and as a result, it includes cortisol levels and enhances our ability to lose weight. It increases libido and also enhances the cognitive and memory functions. This is a neuro-repairing hormone, which is indicator for patients who had disorders, disturbances of neural system due to some toxic harm or some other traumas, including intellectual and psycho-emotional overloads. It is necessary to use this medication, and for this we have laboratory tests. We take the blood tests for pregnenolone. If there is a deficiency of this hormone, then we can prescribe this medication for a patient. In which cases this medication is used is for neurodegenerative diseases, Alzheimer's disease, Parkinson's disease, dementia, and any kinds of manifestations of these diseases, and for prevention of those. Also is dysthymia and depression. Again, this is a decrease in our cognitive functions and our psycho-emotional stability and resistance. By means of improving the work of the central neural system and thanks to the endocannabinoid effect, this medication may be used for PMS prevention, for seasonal allergies as an immunomodulator. It has anti-inflammatory effect when there is inflammation of joints, and when there are autoimmune diseases, when there is a chronic fatigue syndrome, and to decrease the aging process in the body, which is again due to cognitive functions and the work of the central nervous system. But if we use this medication for the patients who do not have deficiency in this hormone, we will have an adverse effect such as drowsiness, anxiety, low energy, perspiration, and agitation. So before you confirm that there is deficiency of this hormone in a patient, there is a strict contraindication for prescribing this drug. The next medication, oxandrolone, it's an active substance in the Biopell line, which is close to tanozolol, but there is certain difference in functionality. This medication was produced and registered for classic healthcare, which we'll discuss. It was quite a long time ago. It was Pfizer in 1964, and the brand name was Anavar. This medication is not aromatized and is not converted into estrogen. So this medication is often aggressively used by athletes because it has minimal low level of adverse effects and no need for surgical interferences, since there is due to its potential high aromatization. How does this medication act? In order to understand, for you to understand, we showed you some visual examples. This actor used to apply this oxandrolone as for changing his body shape, but the samples of how it acts, it's actually like this. This medication was initially used for treating muscle dystrophy when there is a loss of muscle mass in complex therapy of patients with HIV and AIDS, and for treating such problems as osteoporosis when there is lack of calcium. And this medication was approved by FDA as an orphan medication for treating rare diseases, alcohol hepatitis, the terminal syndrome, and also to decrease body weight in HIV patients. It is used for decreasing protein metabolism when there is a prolonged treatment with hormonal and corticosteroid medications. This medication also was used for various enemies. What is the essence of this medication and its major value? The value is this: the anabolic action of oxandrolone is 4 times higher than the testosterone. That's why athletes, sportsmen like it. And the androgen activity of this medication is only 25% of testosterone's action. Why it's important? Because this medication is favored among female athletes who are going for sports, amateur sports, because unlike other medications, this causes less masculinization effects. So women look more like women, but still this the effect is quite high. And the growth of muscle mass is quite substantial, but it's not aromatized at the same time. It has quite low toxicity for liver. And it's important for disseminating this medication is that it is produced in pills, unlike other injection drugs. So oxandrolone now it is called is one of the cheapest anabolics for athletes and sports lovers. Also, it is called a female anabolic because, again, it has a very weak masculinization effect and compared to stanozol and others. The effect of this medication is basically very similar to tanozolone, but this medication, when it is used among men, it is used in combination with testosterone because the androgen activity is suppressed and libido is decreased significantly. So in order to ensure androgen activity of a person's own hormones, testosterone is added. So again, this is like cancerous diseases of urinary system. Also, the adverse effects may be vessel pathologies, cardiac and vessel pathologies, and also severe renal and hepatic inefficiency. Now we finish this block. So, dear friends, before we begin the gynecology block, let's discuss some issues, some questions which we already received in order to establish and kind of strengthen our knowledge on this subject, at least at this hour of our training, and to cope with the unclear moments. So let's start with testosterone. The question is, what is the dosage for a man, and what should be, how many pellets and in which doses should be implanted? So the answer is it's individual, and we cannot answer just in a specific way, in a one clear way. There is no one answer. Our group of physicians have maintained packages for women and men, which consist of a combination of pellets and dosages for ensuring the package of functions like sex, anti-aging, health, strength, and you will have these packages in your chat for knowing, for familiarization, but this is not unified for all patients. These are the minimal doses which you can use for achieving effects. If we speak about testosterone in particular, the minimal dose for a patient who have still production of these hormones in the body, and it's 400 milligrams at least. So we put 400 milligrams of testosterone to a man. Otherwise, lesser dose is not relevant, because if we, for example, say that if we say a person has this additional testosterone, but if the dosage is too high, then in addition to this 400 milligrams, basically every patient, every man, when I speak of age 30 years old and up, tadalafil should be added. The minimal dosage for tadalafil is in pills is 5 milligrams, so 50 milligrams should be in pellet. But if a patient has preserved the function of erection, if he doesn't complain about the frequency of sex, and if it doesn't have any inflammatory processes in prostate, then the supporting dose, which will enhance the testosterone effect and improve his urine and system, and at least improve the restore the negative effect of his sitting lifestyle and office work. It's 400. It's so 400 milligrams of testosterone and 25 milligrams in pellet. And if we take older patients, and if we collect anamnesis of a patient, we asked him if he complains about sexual functions or libido, erection. So a big group of patients respond that they have everything is fine. After the consultation, I select a list of medications, and then I ask the person whether he wants a better erection functions, and 99% of men say that yes. So there is a specificity of how we collect information from men, and depending on the situation, you will evaluate the results and determine the combined result for every patient. Third point, when you use, for example, when we use tadalafil for improving erection in particular, then a patient who comes with complaints about erection function, tadalafil is not enough for such a patient, because if a patient already addresses a physician with erection functions, it's already a chronic patient, and it's not a one-year problem. So with such a long-lasting complaints, basically it's impossible for a patient not to have a psychogenic function, psychogenic factor. So in order to exclude the psychogenic factor and hormonal disbalance, we use at least a minimal doses of testosterone. So when the erection function is old and chronic, there should be a combination of tadalafil pellets and a dosage of testosterone starting from 400 milligrams. When we have DGA in a patient, we use pellets with DGA. We can say that our Western partners regard this pellet as feminine, but we know that this is needed for men too, for quite a large serious process in our body. So the group of patients, male patients who use such pellets is of the age from 45 to 50 years old, in good physical shape, without bad habits. They have sexual and physical activity remaining, and the complaints is depression, exhaustion, emotional burnout, and decreased libido. Emotions become black and white. For such patients, we use the minimal dosage of testosterone, not more than 400 milligrams, because and the tests show that they are within the norm themselves. And then we add DGA, which makes it possible to enhance the emotional color and restore the libido, and to remove the emotional burnout, which is due to serious businesses, stresses, etc. DGA is very good in such case, and it's broadly applied. The same applies to pellets with gonadotropin. When a pellet with chronic gonadotropin is used in gynecology and reproductology for women for enhancing the ability to bear children.
And this pellet is used during hypogonadotrophic hypogonadism, when our gonadotropin is produced in smaller quantity and the reduction of the stimulation of the production of both testosterone, and they are related with each other. To restore fertility and improve the quality of the sperm, this pellet is really applicable, but the only problem is that this pellet is the most expensive pellet of Biopell, and the most short-term gonadotropin pellet lasts for 4 to 6 weeks, but when there is the task of biological impregnation or conception, the sum is absolutely different. And it's about the possibility of the with the biopsy of the testicle, we need to understand whether the testosterone is produced and the gonadotropin level in the man's body is tested, and if possible, this is the test stimulation with the injection form of the gonadotropin of short-term efficacy. If we have the monthly intake of gonadotropin and we see the stimulation of the production of testosterone, then there is the effect of this medication, and it's possible to put more expensive pellet, which will be more physiological and effective. And we have patients who have to take gonadotropin who had aspenospermia, and when they started taking this medication, they improved their spermogram, which made possible to have the biological conception. The dosage of gonadotropin is very individual. That's why it's really important to test it on the injection form and then to understand the dosage in the pellet. As we remember, out of the questions, that's it. Out of the practical questions, I've answered all the practical questions. If you have more questions, please write us and we will answer directly or in the chat. Right now, let's continue our session. and let's take a short break. Good afternoon, dear colleagues. Let's continue our training. So today we will have gynecological block. The fourth block, you have listened to the general characteristics on pellets andrology. What's the next block? And also about the general pellets, about the ones that can be used both for men and women. The only thing is that the dosages are different. And the next block will be gynecological block. So gynecology widely uses pellets. And let me start from introducing. My name is Elena Irka. I am a gynecologist and endocrinologist. And in my practice, I use all the pellets that can be used in gynecology. So let me start by saying about the human chorionic gonadotropin stimulating the synthesis of the sexual hormones both for men and women. And if we speak about the functions which it does in men, it stimulates the production of the male sexual hormones in the testicles. Also, it stimulates spermatogenesis, and in women it stimulates the synthesis of both estrogens and testosterone, and also it provides the ovulation and supports the function of corpus luteum, which appears after the ovulation. And also, human chorionic gonadotropin influences the development of secondary sexual characteristics. When do we use it? We use it when we have the lack of the synthesis of male and female sexual hormones. If we speak about gynecology, the human chorionic gonadotropin is indispensable with different ovulation disorders, the syndrome of resistant ovaries. We use this hormone in the shape of pellets, in the form of pellets, because unfortunately it's available in other forms as well. And if earlier we found the replacement in the form of injection, but injection is parenteral as the subcutaneous implant in the form of pellets. In the cases, apart from the fact that we use it during the syndrome of resistant ovaries, we also use it when women, especially testosterone, come to me. Women come to me and we run tests and we see that the follicle stimulating and luteinizing hormones are below norm or on the low level of norm, and steroid hormones may be within the reference norm. And women have the complaints. First of all, they contact me with the complaints on the absence of period. And in terms of the ultrasound, we see monophasic cycle. There is no phase of ovulation. Ovulation does not appear, and then we don't see the corpus luteum, and this way we prescribe the human chorionic gonadotropin hormone to recover the ovaries function. And we also use it for men in the same dosage, but in most cases in men we use it when men took high doses of testosterone or other androgenics. Further, I would like to speak about the youth hormones. And for women, the youth hormones are testosterone, estradiol, DGAA, and melatonin. With age, starting from the age of 27 or 28 years old, sorry, I will speak Russian. Okay. let's speak about the youth hormones. We have a few youth hormones: testosterone, estradiol, progesterone, DHEA, somatotropic hormone, and melatonin. Starting from 27-28, the synthesis of these hormones reduces, and what happens? Instead of the youth hormones, we need to replace this with something. And to replace the youth hormones, we have the aging hormones, and the person changes, the behavior of the person changes, and the person changes visually, and the stress resistance of the person changes, the posture of the person changes, absolutely the whole body of the person changes. When the patient comes to me for an examination, I use SMART diagnostics. SMART diagnostics is about, first of all, I look at the mood of the person. In particular, if the person from the very beginning, I have the note that the girl who made an appointment for the consultation before implantation of the pellets. So we check the mood of the patient, then we check the appearance of the person and whether the person is skinny or has extra weight. We look at the condition of the skin, look at the hair condition, and after that, we start asking the person about the complaints. And as a rule, the patient, especially when the patient has steroid deficiency, the deficiency of the youth hormones, the patient complains on the fact that he cannot cope with stress, gets tired fast, and some other metabolic changes. The patient says that he or she eats the same food and drinks water, and this water stays and transforms in the subcutaneous fat tissue. After we speak with the patient and have the patient history or anamnesis, we prescribe the necessary tests which have to be taken, which will confirm whether what we think is true or there is a problem because of the chronic stress that all of us go through, and especially people living in Ukraine. And then very quickly, all the hormones, steroid hormones go down and cortisol level increases and insulin and the hormone of aging, which causes different metabolic processes that the patient comes to us with. Every hormone gets reduced gradually, but starting from the age of 35 years, we notice that the youth hormones get synthesized by 50% less. The most glands where our youth hormones synthesize are the ovaries for women, where estradiol, progesterone, testosterone get synthesized, and the adrenal glands where DHEA gets synthesized, and also subcutaneous fat tissue where synthesis of hormones and metabolism of hormones take place. The first hormone, and this is the leading hormone, the hormone of leaders, winners, this is testosterone. You have heard from the previous speaker how important it is for the man, but it's also important for women. Testosterone is the hormone which synthesizes estradiol, and it makes a huge difference and one of the main roles out of all the steroid hormones, because it influences absolutely all the processes in the body. First of all, we're speaking about metabolism. Thanks to the normal level of testosterone, the metabolism changes and improves when we give this testosterone in pellets. And we have three female dosages of testosterone: 75, 100, and 150 milligrams.
When a woman comes with excess weight, and we see by the test that she has insulin resistance, then we prescribe properly correct these testosterone levels, and we gradually achieve insulin resistance decrease. A patient loses weight. The subcutaneous fatty tissue decreases, and the muscle prominence appears, and this is due to the improved function of muscles. Muscles change their structure, and even when girls with excess weight come to us, we prescribe testosterone. We might not see major changes. Maybe there are some plus kilos of weight, but the appearance is totally different. The girls become more athletic. They have beautiful buttocks, beautiful legs. That's thanks to prescribing testosterone in proper dosage. Also, testosterone positively influences the cardiovascular system, and since heart is one of the major muscles in the body, and vessels also contain muscles, so thanks to this normal level of testosterone, we strengthen the cardiovascular system. And when people come to us with expressed steroid deficiency, we collect the anamnesis, and we ascertain that these people also have various disorders in their cardiovascular system. So by properly correcting and gradually correcting the steroid deficiency, we thus strengthen the heart and the vessels. Regarding the bone system, of course, thanks to testosterone, new cells are synthesized in bones, and women do not suffer from osteoporosis, especially if we do it on time, if we find the steroid deficiency in time and correct it in time. The blood forming function is very important. It is synthesis of new stimulation of blood formation and stimulation of new erythrocytes formation. Sexual function is stimulated. We understand that this is a major hormone responsible for libido, which supports libido at high level. It enhances the sexual arousal, sexual desire. And since now we have this chronic stress in which we already live for about 10 months, very often when we see the tests, people's tests, we see the deficiency of this hormone. So girls complain about the absence of libido and inability to experience orgasms. So by changing our hormonal background, we correct this situation step by step. And a very important function is played in testosterone plays a great role in reproductive system improvement. Why? Because starting from the age of 35, the anti-Mullerian hormone levels decrease, and this is the hormone responsible from transforming follicles from various states, and so folliculogenesis is disturbed when this hormone is decreased. So the ovulation might be disturbed, and we cannot replace this hormone with anything because this anti-Melibian hormone is gradually decreasing, and it takes place about until the age of 50. So the ovulation might not happen, but thanks to testosterones, the anti-Melibian hormone is replaced, and testosterone works instead of it. Thus, it stimulates folliculogenesis and for a procession from preantral to ventral follicles, and our girls who come with and have pregnancy after the age of 35, if she's pregnant after the age of 35, we prescribe testosterones of DGEA. Again, colleagues addressed me and asked, what if a girl is pregnant? Will this negatively affect somehow? No, the therapy will not affect her because we support the physiological levels of testosterone. We do not have a task of enhancing the dosage. We just turn the time back. We ensure the hormone background, which is supposed to be at the age of 20 to 25 years old, but not at the level of 35 as she is. So these are the major functions which are performed by testosterone, and thanks to the fact that we correct the norms and doses of testosterone in female organisms, we see how a person changes. Girls wake up easily. They have more leadership ability. Testosterone also improves the cognitive function. They are always energetic. As one of my patients said, my husband told me that my wife is, which never has headache. So there is a sexual desire, sexual arousal, a psycho-emotional background is better, the mood is improved, and the concentration is improved, especially after the first pellet therapy. A girl says that actually she can recognize new materials better, especially those who study foreign languages. They say that it's much easier to acquire new language. Also, they have additional energy which is supported during the day. They don't have fatigue at the end of the day. They can easily do many things at home after work, only thanks to the fact that we prescribed and changed the levels of testosterone in their body. Regarding reproductology, we already discussed this a little bit. I know the fact that the androgen protocols are applied in assisting reproductive technologies because all eco clinics actually used to apply only DGEA, but now those physicians who work in eco clinics, they use this hormone because and pellets are very helpful because it's a very good form. It is fully absorbed, has no adverse effects, and it is controllable because, as we know, a pellet releases every time, every minute, every second, exactly the needed amount of hormones for proper functioning of the female body and for compensation of the deficiencies which may arise in her body, which helps planning additional therapy schemes and, like, for example, the intake of egg cells for reproductive technologies. What I've told you a little bit earlier, this is a positive influence on bone and muscle system, and testosterone also positively influences joints. As a gynecologist who works with patients, and patients address me with some aesthetic issues. Aesthetic issues are due to prolapses, like prolapses of pelvic organs. Earlier, we prescribed various kinds of therapies, surgical and other ones, laser therapy, laser improvement of vagina, some sling surgeries, or laparoscopy. But now this is what we already we already treated the consequence, but we understand that there is a cause, and an optimal way, of course, is to affect the cause, and the cause is exactly in the fact that muscles are stretched, they lose their ability to contract, and collagen fibers weaken. The elastin is missing, and thanks to the fact that we start correcting not from surgery but from solving the cause problem, why these problems actually arise. We laser, or if the situation is more severe, we prescribe that very surgery. It's very important to correct testosterone level when women come to us in menopause age. Such women often have a condition which is called genitourinary syndrome, GUMS. And if we used to have an earlier approach to prescribe estradiol as a feminine hormone, either as local forms of administration, or there was a systemic administration through plasters, pills, sprays. But now if we take various sources, scientific sources, and look at the comparative characteristics among women who underwent estrogen treatments and testosterone treatments, it ascertained that testosterone treatment actually gives a much better and prolonged results than estradiol, because we understand that the pelvic floor, as mentioned, is contains of many joints and the subcutaneous fat. So estradiol works on mucus, and testosterone actually covers all these layers of all tissues and strengthens joints, strengthens muscles, and thus it improves the mucus condition.
Part of the testosterone goes to the synthesis of estradiol. Sometimes people in menopause can get the prescription of testosterone in the form of pellets, which will make it possible for us to solve the problem of the lack of estradiol. It will increase the level of estradiol, and it will also increase the level of testosterone itself. That's why it is really important. This is a really important hormone. It is a hormone of anti-aging therapy, which is one of the most important hormones which we prescribe frequently for people in the age category 35 plus. But testosterone has side effects, and side effects are about the fact that if we correct the wrong way the dosage and select the dosage the wrong way and started from the high dose, sometimes we may have anxiety, and anxiety gets reduced. if we listen to our Brazilian colleagues prescribe anxiolytics, and in practice it is also acne, sometimes quite severe acne. In this case, we use spironolactone, and for short term, about 1 month, up to 1 month, in the dosage of 100 milligrams once a day, better during the first part of the day. But then again, this complaint is not very widespread, and it happens when we take the high dosage of testosterone in the first place. And when the person for the first time comes for the implantation of pellets, we don't know his or her reaction. It's better to start from the low dosage of testosterone 75, and then we look at the response and the reaction to that dosage. And after 4 months, because it acts for about 4 months, and after 4 months we run the tests, and if the patient tolerated that dosage the right way, we can increase the dosage gradually. Then we can use the dosage 100 or 150. These are the basics of testosterone prescription, and let me repeat by saying that this is one of the most important hormones for women in the anti-aging therapy, which we apply in the form of pellets. By we, I mean gynecologists. One more hormone is the dihydroepiandrosterone, or DHEA, or prosterone, which gets synthesized by adrenal cortex. The peak of the secretion is in the age of 20 to 30 years, and after 30 years, the level of this hormone goes down, and the adrenal glands reduce the synthesis of this hormone, and closer to the age of 45, there is a significant deficiency of this hormone among the average women. During menopause, both and ovaries lose their function. There is the natural decline of the ovarian function. Then this is the main steroid hormone which supports the body of the woman. But there is one but. This androgenic effect is lower and estrogenic effect is higher. That's why it's really important to carefully prescribe this hormone for people who have estrogenic dependent formations, especially if we speak about the womb or uterus, where we can notice in the anamnesis or patient history myomas, polyps, and if we speak about the mammal glands, we may speak about different mastopathias. If we speak about thyroidogenesis, so this DHEA gets synthesized, and the main part for the synthesis of all the steroid hormones is cholesterol, and the next DHEA goes, and then we have testosterone by the aromatization method, and out of testosterone, estradiol gets synthesized. The functions are really important for the female body. I mean mood, memory, libido, and bone density, muscular development, both of the skeleton, muscular system, and all of the other muscles, in particular, including the muscles in the cardiovascular system, and also the quantity of fat deposits. This is the hormone when, if rightly prescribed, it promotes losing weight and the reduction of the fat deposits in the body. So dehydroepiandrosterone is really important from being hormonal steroid hormone. It is also an antioxidant neurotransmitter because it has an effect on the memory and it has an effect. It promotes the improvement of cognitive functions and it provides immunomodulizing effect, anti-inflammatory effect, and as we have earlier said, this is the regulator of lipid and carbon metabolism and carbs metabolism. The reason of reduction, it gets reduced due to age, function reduction options, and trying to understand the reason why this DHEA reduced, we found out that she takes methylprednisolone due to autoimmune process in her body. That's why it's really important to collect and clarify the patient history, anamnesis the right way, and clarify everything because the patient may not inform you about everything she intakes because may not consider it to be relevant. That's why we've spoken about excessive weight and endocrine system diseases like Cushing's syndrome and other diseases when there is the lack of this DHEA. Also, very abruptly, the DHEA goes down during stress. Why it happens this way? Because cholesterol goes to the synthesis of stress hormone and goes to the synthesis of DHEA. And when the person experiences stress, especially if it's the chronic form, then the body needs to protect itself somehow, and to maximum, it synthesizes cortisol to protect itself, to protect the body from stress. And cortisol has a catabolic effect and it promotes the deposition of subcutaneous tissue, gaining weight, and this way the anabolic hormones, including DHEA, significantly go down. And people get the disorder of the detoxification function of the liver, and all the processes suffer the DHEA effects, and the immune system weakens. Of course, memory and mood will also suffer. And when the patient comes to us for an appointment and we start asking the question about her complaints, and the patient very often speaks about the following complaints. Excessive weight. She says that the war started and I gained extra weight and I don't know how to lose it. I tried all the diets, but I gain more and more weight and I can't cope with it. So such patients notice the deterioration of skin quality. They say that the skin became dry, it became dull with the cellulitis, there is sagging, and sometimes cellulitis may happen also with the deficiency of body mass or with normal body mass. And patients may complain on the declined focus, memory problems, depression, chronic depression, and also on the decrease of libido. And if we speak about testosterone, with testosterone, there are few possibilities to correct testosterone with other medications, and the most optimal treatment method is pellets. So with DHEA, we know about creams and capsules, but there is one but. When the patients come to us, they don't have the possibility to take every single day the dosage of the medication in the form of the creams or capsules. That's why the optimal approach to the correction of these changes, the lacks, the deficiency, would be the pellets with DHEA. And prescribing DHEA pellets, which absorbs within 6 months, we know that every single day the patient will receive DHEA dose, which will help to compensate and make up for all the deficiencies. Just like with the testosterone, with DHEA, maybe it was the increased dose of DHEA. And here we speak about the fact that for women, if we speak about the number of pellets with DHEA, it's just about one pellet. And with the overdosing, we see hyperarousal, irritation, and sometimes the patient says about the disorder of menstrual period cycle during any other form of hyperandrogenics. And also the patients
Patients have hair loss, acne, and enhanced fattiness of skin fattiness. But if only skin fattiness is increased, I always say to my patients that in older age, skin is never fatty, so sometimes it's a normal indication of a normal level of hormones, especially masculine hormones like DHEA and testosterone. Can you tell me, please, when we're supposed to make a break? Okay, then let's consider gastronome also, and then make a 10-minute break. So, pellet, you already heard about such a name as a combination of pellets, beauty chip. Beauty chip includes testosterone and also the translator cannot hear the speaker's sound. Okay. Mostly we prescribe pellets with in beauty chip together with testosterone for girls when they have signs of hyperestrogenemia. Hyperestrogenemia is excess levels of estradiol in blood, which causes changes in the mood, in temper. It's enhanced irritability, tears, edema. Also, such girls have cellulite and edema forms of cellulite. They complain about increased body weight, expressed manifestations of PMS, especially of edema in mammal glands, and also decreased libido. And when we examine such patients, we will see mastopathy. In anamnesis, as a rule, we can see hyperplastic processes. When we conduct ultrasound of the pelvic organs, we'll see either endometriosis or leiomyoma, or also such patients, when we confirm all this with laboratory tests, we can say and confirm our guess that such patients have either relative or absolute estrogenemia. So we prescribe this beauty cheap pellet, testosterone together with the second hormone. This is a problem with battery charge. So let's continue, and now we discuss gastrinone, which is including a combination of a pellet, which we gynecologists and we call it the beauty chip. Gastrinone, as I already described, it positively affects all hyperestrogen processes because it decreases the estrogen levels in the body, and we have two types of pellets, gastrinone A and gastrinone B. They always are combined together. Gastrinone A is implanted because it is fast and it has an effect, manifested effect already after 72 hours after administration. But it is a short-term effect medicine. It acts only for 1 to 2 months. After that, there is already the action of gastrinone B. It starts acting after 2 months after following the implantation, and it acts up to pellets with 2 gastrin 6 years for anti-estrogen effect. How do we dose? What is the dosage? If we have the goal of only decreasing the estrogen levels, we can administer only 1 or maximum 2 pellets. If our goal is to ensure contraception, prolonged contraception, then the number of pellets will be from 3 to 8. How do we determine whether there is a contraception effect after pellet therapy or not? We look at the luteinized hormone and follicular stimulating hormones. If the levels is below 1, it means it's a very good contraceptive effect. If the LH and FSH is not decreased, then we need to implant another pellet in order to decrease these hormone levels a bit to below 1. There is also, just like when administering testosterone, despite the fact that gastrinone has an easy androgenic effect, we can have such side effects. I wouldn't even say that these are real side effects, but if we administer gastrinone with the purpose of contraception, the ovulation, it blocks ovulation, and the menstrual cycle might be absent for as long as this pellet is acting. Also, girls complain about such side effect as seborrhea, hirsutism, and hair loss. And depending on these complaints, we prescribe relevant therapy. The next hormone is the feminine hormone, is estradiol and estriol. Estrogens are female steroid hormones which are synthesized by ovaries and follicles in ovaries, and in less of it is synthesized in adrenal glands, and the metabolic function, the metabolism is taking place in subcutaneous fat tissue. The effect is feminizing. If we speak about the positive effects of estradiol, there are many of them, because estradiol, together with testosterone, positively affects all the systems and tissues of a female body, and male also. If we speak of the reproductive function, estrogens, when the levels of estrogens are relevant, they contribute to fertility. Next, if we take the cardiovascular system, since estrogens preserve the elasticity of vessels, and also counteract the formation of clots in vessels. Also, they control the cholesterol level, normalize the cholesterol level, and also the inflammatory processes are decreased, because we know that atherosclerosis is a chronic inflammatory process. The bone system here, estradiol actually is a very important hormone, because thanks to the normal levels of estradiol, there won't be any osteoporosis, because estradiol prevents resorption of bone tissue, and also it contributes to synthesizing new bone cells. The skin elasticity and collagen preservation, synthesis of new collagens, prevention of destruction of elastin is due to normal levels of hyaluronic acid, and this is actually the consequence of normal levels of estrogens. If we speak about the effect on brain, first of all, new neural connections, neural links are formed. It's improved memory, attention, and also it contributes. The normal level of estradiol contributes to normal sleep. It is believed that estradiol is not as sharply decreasing compared to androgen hormones, and the normal level of estradiol can be preserved to menopause. When a woman should address a gynecologist and the endocrinologist when she sees less of menstrual blood, and when the menstrual cycle prolongs, when there is a sharp decrease of menstruations to 2 or 3 days, then we need to test the levels of estradiol and check whether there is no menopausal syndrome, that there is no syndrome of early dysfunction of ovaries, and if any of these symptoms is manifested, then with time we need to compensate for these effects. If we speak of such sharp changes and decreases of estradiol, for example, women come to us and complain about enhanced perspiration, increased perspiration, fatigue, sharp inflows of heat. Also, the sex fluid suffers. They have dry sensations during coitus. They have cystites. They have atrophic vulvites and vulvaginites, and also the decreased libido, one of the symptoms. Also depressed mood and fatigability. As usually it is observed in such cases when there is a sharp and significant
Причины снижения эстрогенов, ну, основная и самая частая причина – это возраст. Возраст менопаузальный, то есть менопауза в норме наступает с 45 до 55, и тогда идет резкое снижение синтеза эстрогена, потому что яичники отключаются от работы и перестают постепенно синтезировать эстроген. Также он снижается при дисфункции яичников, которая возникает в результате различных гормональных изменений. И изменение работы гипофиза, на которые могут влиять или нейроинфекции, или другие гормональные состояния и заболевания, синдромы, симптомы, а также когда девочки злоупотребляют силовыми видами спорта, также девочки, которые находятся в состоянии стресса, при неправильном образе жизни и при синдроме ранней менопаузы, то есть синдроме раннего истощения яичников. У кого-то из пациентов происходит резкое снижение, и тогда у них все симптомы, о которых я говорила, это приливы, чувство жара, бессонница, утомляемость, стресс все-таки возникает постепенно. И очень важно своевременно выигрывать это состояние, потому что благодаря правильному подбору и дозы, и количества препарата мы сможем предотвратить. Блин, что это такое? Да, благодаря тому, что мы своевременно обнаружим
Sorry for the technical problems and thank you for your patience. So the reasons of estrogen
Причины
decline,
снижения
the
эстрогенов
reasons of
это
estrogen decline
менопаузальный
is
период,
menopause
это
period,
различные
is
дисфункции
different
яичников
ovarian
в
dysfunctions
связи с
due to
другими заболеваниями
other
той же
diseases
эндокринной системы
of
или
the
воспалительными
endocrine system or
заболеваниями,
other
вирусными
inflammatory
заболеваниями.
diseases, viral diseases,
Дальше это
and
нарушение пищевого поведения, это какие-то
also
экстремальные
this
виды диеты
nutrition
или это
disorders
какие-то
or extreme
повышенные
diets
физические
or some
нагрузки, это,
excessive physical
в общем,
trainings
все, что
and workouts.
кардинально
So
и
everything
радикально
that
меняет
significantly
привычный
changes
способ жизни.
the
От этого
usual
может
lifestyle.
снижаться
And due
уровень
to that, the
эстрогенов,
level of
синтез
estrogen
эстрогенов
may
фолликулярным
decrease,
аппаратом
the
яичников.
synthesis of the
И
follicular
в связи с
apparatus of the
этим
ovaries, which is
появляются те
done, may decline,
самые
and
состояния
due to
заболеваний
that,
и
different disorders, diseases
нарушения,
appear,
которые
which
могут быть
may be
следствием вот
the
этих всех
result of
состояний.
all these conditions.
Продолжим. Если мы говорим в целом о том, чего мы хотим добиться с помощью пилет, то основная категория пациентов — это пациенты, которые хотят работать с эндокринологом, с гинекологом, со специалистом антиэйдж-терапии для того, чтобы возобновить свой гормональный фон. То есть для того, чтобы повысить энергию, повысить либидо, сексуальность, обаятельность, убрать подкожно-жировые отложения, то есть похудеть. Вот это те категории пациентов, и, соответственно, мы видим и здесь и на фотографиях, и мы наблюдаем на своих пациентах, что мы получили спустя 6 месяцев. Очень часто я говорю своим пациентам, что мы работаем не на количество, мы работаем на результат. Что это значит? Пациент, который к нам пришел, которому мы помогли добиться тех целей, которые он перед собой поставил, он к нам приходит на последующее ведение. У меня есть пациенты, которые ко мне приходят на третье, четвертое, пятое, шестое ведение пилет, которые мы только меняем в зависимости от пожеланий пациента. Если она говорит, что вот хочу больше поработать с кожей, то мы добавляем те гормоны, которые работают с кожей. Если она говорит, я поправила, употребляла едой, или у меня аппетит там изменился, тогда мы в основном работаем уже с весом. Мы можем работать со всеми этими жалобами и их успешно и быстро компенсировать с помощью пилетотерапии. И, конечно же, когда к нам пациент обращается для введения пилет, то мы начинаем с обследования. Обследование мужчин вы видите здесь на экране перечень анализов, которые необходимо пройти мужчинам и женщинам. Если у женщин сохраненный менструальный цикл, если у них месячные регулярно, тогда мы назначаем перечень лабораторных исследований с 3 по 7 день от начала менструации. Если цикла как такового нет или он нерегулярный, тогда мы назначаем перечень этих анализов, в том числе и гормонов, вне зависимости от фазы менструального цикла. Дальше мы назначаем дополнительные исследования, которые могут быть и ультразвуковыми, и различными рентгенологическими исследованиями, в зависимости от того, как мы собрали анамнез и какие отклонения мы обнаружили. Возможно, нам нужно будет получить консультацию смежных специалистов. Дальше мы, после того, как получим анализы пациента, мы приглашаем его на повторный осмотр, где мы уже подбираем то количество, тот вид пилет, который необходим нашему пациенту. И сама процедура введения пилет, она достаточно простая, она заключается в том, что мы как правило, это проводится под местной анестезией. Иногда, очень редко мужчины просят поставить пилеты под наркозом. Но это когда мы
So when we implant the pallet, the procedure is quite simple. Then we recommend to abstain from physical workouts, not to do sports for 1 week. Then we ask to exclude massage within this period of time during these 7 weeks, and also taking advantage of the derm patches. It enables taking a shower and keeping the patch on the cut for 7 days. So after the palette is implanted,
Потом через 7 дней мы просто снимаем пластырь и в основном маленькие только место прокола, место введения тракара мы видим. К сожалению, как и при любой другой, и в том числе микрохирургической операции, могут быть различные осложнения. Осложнения, в основном, которые мы наблюдаем после введения пилет, это экструзия, то есть когда организм выталкивает пилет, у меня даже девочка была, у которой пилета немножко вышла, она не полностью вышла, но она подтянулась близко к коже спустя 2 месяца после введения. А вообще самая основная жалоба — это воспаление в области пилеты, покраснение, нагнаивание, это кровотечение с ранки. И если мы поставили достаточно поверхностно, то мы также наблюдаем контурирование импланта. И в первые 7 дней иногда бывает отек и покраснение, и легкий болевой синдром, особенно после введения НАД. Локальное покраснение в месте введения является нормой. Мы всегда предупреждаем пациентов об этом, а все остальные изменения, то они требуют последующей консультации доктора, который ставил пилету. Ну, здесь мы видим на слайдах, когда у мужчины контурировалась пилета, здесь у девочки получилось после пилеты очень выраженное воспаление. Здесь была нарушена технология введения пилеты. И вот когда я промывала, обрабатывала, проводила хирургическую обработку раны, то при очередной обработке у меня эта пилета просто вылетела с раны. Часто доктора, которые приходят на обучение, говорят, что пилеты там могут вызвать и онкозаболевания. Это все миф, потому что пилеты они биоидентичны. Биоидентичные пилеты — это те гормоны, которые мы вводим в виде пилет, они такие же, как и гормоны, которые синтезируются нашим организмом. Соответственно, никакой повышенной стимуляции, в том числе канцерогенеза, быть не может. Еще один миф, который хочется развеять, это что организм привыкает к пилетам и снижается собственная выработка тех же гормонов. Ну, уже доказано многократно, что свои собственные гормоны, синтез не снижается, потому что не идет, организм не воспринимает пилету как что-то чужеродное, то есть он воспринимает те гормоны как те, что у него синтезируется собственным организмом человека, и, соответственно, в результате этого функция наших желез не нарушается. Ну и частый миф, иногда мне девочки, особенно когда началась у нас война, они говорят, что вот, а если я не смогу ставить дальше пилеты? Если человек отказывается от пилетотерапии, соответственно, он возвращается в тот гормональный фон, который у него синтезируется в связи с его возрастными особенностями и другими нюансами. Поэтому привыкания к пилетам нету. Пилета перестает действовать постепенно, она резко не снижается, ее поступление в кровь. Соответственно, и синдрома гиперторможения тоже не будет. Ну, неизвестный состав в каждой пилете. Мы понимаем, какое действующее вещество. И прописано мало того, что количество действующего вещества у вас в таблице будет, также прописано количество вещества, которое выделяется в сутки. Поэтому мы знаем не только состав пилет, но
Only the
мы
composition of
можем
every
прогнозировать,
pellet is
сколько будет
known,
поступать
but
этого вещества
we can
активного
actually
в кровь
predict how
каждый
much
день.
of the active substance will be released into blood every day.
Всё.
That's it on my side.
Это все, что касается
That's
блока
everything
по
which is related to
гинекологии,
the
тех
gynecology
пилет,
block,
которые мы
those
применяем
pellets
в
which we
гинекологии.
use in gynecology,
И у нас еще
and
есть
we also have
пилеты
pellets
с преднизолоном.
which with
Пилета с
prednisolone.
преднизолоном ставится
Prednisone
при,
pellets are
в основном
administered
ее используют
and mostly
эндокринологи
used by
и ревматологи.
endocrinologists.
Если мы говорим
If
об
we
различных
speak about
аутоиммунных
various
процессах, то
autoimmune
это, как
disorders,
правило,
autoimmune
ревматолог
disorders,
занимается такими
then
вопросами. Также
rheumatologists are
при
dealing with these issues,
аутоиммунных
and also
процессах назначают эндокринолог.
endocrinologists prescribe
Пилета с
pellets for
преднизолоном
autoimmune
ставится в
disorders.
связи с
Such a pellet is administered
выраженным источником истощения. Когда мы видим,
when
что
there is expressed
уровень
fatigue,
гормона кортизола
when we see
уже
that the level of
крайне низкий.
cortisol
Когда
is extremely
человек
low, a
очень
person
продолжительное время находился в состоянии
has
стресса, и его э, гормоны, его надпочечники перестали уже синтезировать гормон кортизол. Поэтому таким людям с хронической усталостью, с хронической депрессией при определенных лабораторных показателях мы можем ставить пилетку с преднизолоном. Также у нас есть пилеты, которые мы ставим с целью похудения. Это пилеты с метформином и бета-глюкином. Метформин — это вещество, которое используется для лечения синдрома инсулинорезистентности, для лечения ожирения, для лечения сахарного диабета второго типа уже на протяжении многих лет. Это вещество давно было синтезировано и давно изучено. Но почему мы говорим про пилетотерапию? Есть самая часто используемая форма этого препарата. Это препарат, который принимается в виде таблеток. В виде таблеток препарат зарекомендовал себя хорошо, но с определенным количеством побочных явлений в виде нарушения функции желудочно-кишечного тракта. Есть люди, которые просто не воспринимают метформин в таблетированной форме, и это вынуждало их до появления пилет отказываться от этого вида терапии. Благодаря тому, что пилеты ставятся подкожно, благодаря тому, что именно такой уникальной форме освобождения пилет метформин требуется значительно меньшее количество веществ этого действующего вещества метформина, мы наблюдаем, что побочных эффектов при пилетотерапии с метформином практически нет. Поэтому метформин в виде пилеты мы используем как раз-таки для пациентов, которые хотят у нас сбросить лишний вес. Используется от 2 пилет и до 8 пилет препарата. Мы подбираем количество пилет в зависимости от цели, сколько хочет пациент сбросить, от лабораторных показателей и от его водной массы тела. И разумеется, что если человек имеет избыточную массу тела более 20 килограмм, то 2 пилет это будет крайне недостаточно. Мы назначаем большие дозы метформина и большее количество пилет.
Higher number of
Если
pellets.
говорить о метформине не
If we
только
speak of
о препарате, который
metformin as not just as a substance which is used
похудению,
which
еще
contributes to
очень
losing weight,
важную
but
функцию он
also
выполняет,
there is such
и
it performs
проводятся
other
различные
important
исследования
functions, and there are
по
studies regarding
его позитивным
its
свойствам.
positive characteristics and effects.
Дополнительные свойства. Во-первых,
First of
он
all,
может
metformin can
регулировать уровень стероидного гормона.
regulate the steroid hormone levels,
Гинекологи-эндокринологи
and
используют
endocrinologists and gynecologists use
яичников, потому что
it
он
for treating girls with ovary dysfunction because this hormone
реакций способствует возникновению
contributes to reproduction
уровня андрогенов, которые
and the
являются
decrease of level of androgen hormones,
клиническим проявлением
which
синдрома
are the
поликистоза
clinical
яичника.
manifestation of
Очень
polycystosis.
важную роль
A very
метформин
important role is played by
играет в
metformin
анти-эйдж-терапии, потому что он
anti-age therapy
противодействует и он
because it
помогает в комплексном лечении
helps
синдрома
to
Альцгеймера
ensure
и
complex treatment
Паркинсона.
of Alzheimer's disease.
Также метформин имеет онкопротективное влияние, и исследовалось большое количество людей, проводила под эгидой FDA, проводила свои исследования, где участвовало больше 3000 людей, и доказано было, что он имеет очень выраженное анти-эйдж проявление, свои анти-эйдж свойства. Поэтому метформин и метформин с бета-глюкатиной используется в виде пилет для лечения ожирения, и не только его, но еще и мы можем, как гинекологи-эндокринологи, его использовать в виде пилет для лечения синдрома поликистозных яичников. Ситоглюкатина, она есть как отдельная пилета с ситоглюкатиной, так и есть в комбинации метформин с ситоглюкатиной. Ситоглюкатина, она, кроме того, что снижает уровень сахара в крови, она также замедляет. Мгм.
Sitagliptin action, it decreases the levels of sugar in blood. It also contributes to synthesizing insulin, and a very important characteristic of sitagliptin is that it decreases the passage of food along the gastrointestinal tract, which ensures stable supply of glucose into the blood. It regulates sharp hunger sensations, and it contributes to prolonged saturation and feeling of satiation. So if there is a combination of sitagliptin has recommended itself as a very efficient medication that works quite well, but it almost has no adverse effects. And in pellets, it also has a very good effect on sugar levels and throughout the period when there is the pellet therapy. Dear colleagues, thank you very much for your attention. As Anton said, we are all together with you 24 hours a day, 7 days a week, in order to ensure that you successfully start applying pellet therapy in your practice. And the whole literature, everything, all the materials will be provided to your group. We will support you at the first stages of working with patients. As soon as there is an opportunity, we see when we will be able to gather together physically. I wish you all success and easy beginning of working with pellet therapy. I greet everyone with the Christmas and upcoming New Year. Let all your dreams and wishes come true.